everyone, I am Indrajot and I am a cornea fellow at LJ Eye Institute Ambala. I welcome you all to this second episode of After Ophthalm series, The Glamorous Glaucoma. You know what? Like Darshana told you in last episode, I also went through the phase of After Ophthalm syndrome. But in my case, this dilemma of what next lasted for a good 5 years. Dear friends, just imagine a crystal clear cornea, a perfectly dancing iris, a luminous lens, wavy wow vitreous, and a rapchic retina. A perfectly looking eye but with a cavated disc is just like a human body without a soul. Yes, optic nerve is the lifeline of vision, and protectors of this lifeline are our glaucoma warriors. They are constantly in a temple run race to save that temporal island of vision. Do you want to be one of them? If so, this episode, The Glamorous Glaucoma, is for you. Let me introduce you all to 5 such glaucoma warriors across India who have a plethora of experience in glaucoma. They are Dr. S.S. Pandav, Professor of Ophthalmology at Advanced Eye Care Center, PGI, Chandigarh. Dr. Sirisha Senthil, Head Glaucoma Services, LV Prasad Eye Institute, Hyderabad. Dr. Sunita Dubey, Head of Glaucoma Clinic at Dr. Shroff Charity Eye Hospital, New Delhi. Dr. Urvish Vashisht, Head of Glaucoma Services at LJ Eye Institute, Ambala. Dr. Sushma Tejwani, Head of Glaucoma Department at Narayana Netralaya, Bangalore. Aren't we curious as to what was their inspiration and how their journey was? To know this, let us peep into their lives by asking them 5 questions. Are you excited? Chalo then, let's start with our first question. How glamorous do you feel glaucoma is, and what made you choose glaucoma as a field of specialty to practice all your life? Let's hear from Dr. Senthil.
Pediatrics was my first choice, and I landed up in glaucoma out of a need. So earlier place where I was working, there were no glaucoma specialists, and I used to take care of glaucoma patients as well. And then I realized that there were just too many of them, and sometimes I would be able to take a decision, sometimes it was I needed help, and then I realized that I need to train myself to be able to take care of these patients much better, and that is how I chose to do some training in glaucoma. And I had a young baby at that time, and it was not easy for me to take a break. So I decided the shortest possible training that I could do, I should do and get back. And that's how I landed up in LV Prasad to do my short-term fellowship. And the maximum time that I spent here, I trained under Dr. GC. And all of you know about Dr. GC and how inspiring he is. And sometimes he also pushes you to do your best and to bring out the best in you. And I guess that really helped me a lot. And that is all I did, and I went back and I started practicing. In fact, sometimes I tell my fellows that the first surgery, I only observed surgeries. Nobody held my hand and helped me to operate. But I used to be so keenly observing or helping or assisting because I knew this is the only opportunity I have to learn, and I have to go back to give the best to my patients. So when I went back to the place where I was practicing, and the first surgery that I did was on my husband's boss's mother, and that was the most difficult time, or really a tensed moment, because he somehow believed that I could do the best and they just didn't want to go anywhere else. I said, no, please, I will refer you to another surgeon who is obviously much more experienced than I am. But for some reason, this elderly lady had so much trust in me that I had to do my best, and fortunately for her and fortunately for me, it went off very well, and that is how my career in glaucoma started. And then glamorous, I'm not sure whether glaucoma is glamorous, but yes, I would say that for any anterior segment surgeon who is good at doing cataracts and taking care of anterior segment problems for most patients, I think glaucoma is a field that you can't escape. So to me, yes, if you are an anterior segment surgeon or a cataract surgeon, and then if you're good in glaucoma, I guess it adds another flag to your capabilities.
Thank you, Dr. Senthil. Let's hear from Dr. Pandav.
Why do I find glaucoma glamorous? Well, it depends what you mean by glamorous. If you are under if you want very quick, gratification or monetary things, then glaucoma is not probably very glamorous. But if helping people is in your mind and creating new knowledge in your mind, then glaucoma actually gives you a lot of opportunities. There are many unknown things about glaucoma, and there's a lot of opportunity to do research, to find newer methods of diagnosis, treatment, and helping people in different ways. Because glaucoma is a lifelong problem, so it gives you a very long opportunity to be associated with your patient for a very long time and help them and understand their problems and create newer methods of treatment. So that way is very exciting, and I find that aspect to be very glamorous about glaucoma. So what made me choose glaucoma as a lifelong profession? I didn't exactly choose it consciously. I think it just happened over a period of time. When I started, I was doing everything: cataract, retina, oculoplastics, glaucoma, among other things. But I think in early 90s, when I got an opportunity to work with Professor Amol Gupta, who is my mentor, and he was doing retina at that time, and as well as running glaucoma clinic. So I started working with him, and over a period of time, most of the glaucoma patients, they started kind of accumulating in my clinic, and I started enjoying glaucoma work more than perhaps retina work. So it was kind of a glaucoma grew on me rather than I choosing it consciously.
Thank you, Dr. Panda. Let's hear from Dr. Dubey.
Yes, glaucoma is glamorous in the sense that what you see is just the tip of the iceberg, and there's a lot more which you can explore and understand about glaucoma. I was always very fascinated by this specialty because of its complexities, and was always keen to be associated with patients of glaucoma and to do a fellowship in glaucoma. However, it was not possible for me to do a fellowship that time, and I opted for senior residency at Dr. Shroff's Charity Eye Hospital. However, to my dismay, even after completion of a successful comprehensive residency, there was no job opportunities for me that time. The trend of the fellowship had already started, and even our hospital was looking for consultants who had fellowships. So that was a huge setback for me. However, I am very thankful and grateful to our management that time, and especially the CEO, Dr. Stephen Roy, and Dr. Shroffs, who believed in my potential that time and gave me the opportunity to serve the hospital in the capacity of a consultant. They also gave me the opportunity to do a fellowship at the very prestigious Wills Eye Institute under the able guidance of the stalwart Professor Dr. George Spaeth. And that was like a dream come true for me. So that was the beginning of my career or my journey in glaucoma.
Thank you, Dr. Dubey. Let's hear from Dr. Tejwani.
For me, the glamour isn't something that throws continuous challenges at you. Because I feel when it becomes monotonous, you tend to, sort of become lazy about it. So, in fact, I had interestingly a 3-year comprehensive fellowship at LVP and had the exposure to all the branches for that matter. And towards the later part of the fellowship, when I was asked to choose a subject, I was actually confused, and I initially took oculoplasty, then pediatric ophthalmology. But then during the later part of our fellowship, we used to have a system where you get coverage postings. That means you are supposed to cover for a particular consultant who's not there or on leave. So at that time, incidentally, one of our glaucoma consultant had left. So I was put on postings of coverages of that particular consultant, and my OPDs used to fall along with Dr. G. Chandrasekhar, who's currently the chairman of LVP. So with him I learnt a lot, and actually could see how you can use the evidence-based medicine for making any decision in glaucoma. For even choosing a drop or even changing a drop or anything for that matter, there are reasons why you do it. So that is what actually attracted me towards glaucoma, because there was so much science involved and evidence involved in everything that you do. even glaucoma surgeries, when you finish, it is not that you operate and then it's the end of it. A lot of things that go on after that so as to make it work. So that was something that attracted me towards glaucoma, and actually I got stuck to it.
Thank you, Dr. Tejwani. Let's hear from Dr. Urvish Vashisht.
Actually, I never chose glaucoma as my first choice. It is otherwise. The glaucoma chose me. What happened was, I did my comprehensive ophthalmology fellowship from L.V. Prasad Eye Institute with subspecialty training in pediatric ophthalmology. And after the fellowship, I was practicing strabismus, pediatric ophthalmology and adult cataracts and pediatric cataracts. And I was very happy doing that. But as the circumstances would have been, I came into contact with Dr. Vikas at around 2010 or so, where he asked me that whether I can manage his squint patients. I said, why not? So while I was seeing squint patients, he also showed me few glaucoma patients also. I said, okay, I'll see them, because I had some exposure to glaucoma during comprehensive ophthalmology fellowship. So I started seeing the glaucoma patients, and that is how I started seeing glaucoma. But I found glaucoma patients to be very, very challenging. Every patient was different. So I started reading more about glaucoma, and I found it to be very, very interesting branch. Slowly my glaucoma practice, it partook the strabismus practice. So now almost 80% of my practice is glaucoma, only 20% is the strabismus. So that is how I shifted to glaucoma, and I'm really enjoying what I am doing right now.
Thank you, Dr. Vashisht. So you've heard, it is glaucoma which grew over our warriors. Cupping of a disc or pink of the rim, Travaux-Timo equation or a one-digit tension, filtering bleb or a peeping tube, trabecular mesh or an aqueous gush. Dear stars, what is it that gives you a rush, a kick in glaucoma and brings a glow in your eyes? Let's hear from Dr. Pandav.
Basically, we all know glaucoma is a chronic problem, and it leads to severe visual handicap, and if you don't treat it, most of these patients will go blind and will lose their independence to do things. So whenever you are associated with a patient for a long time, say you have been treating somebody for 10, 15, 20, 30 years, that's how long I've been practicing glaucoma actually. So that means then you know the outcome of your treatment on a long-term basis, and if you can find people who are still coming to you for the last 25, 30 years and they are independent, they can come to your clinic and they can chat with you about their life and what the difficulties they face or what are their achievements. I think that gives you a lot of satisfaction, and that is a great feeling, and that's what actually creates a lot of happiness. So I would say that is the driving force that we have behind treating glaucoma patients.
Thank you, Dr. Pandav. Let's hear from Dr. Senthil.
So one may ask this question that what is there in glaucoma? Everybody with a high pressure needs to be treated with medications and that's it. But then you need to understand that everybody with high pressures don't respond the same way. The reason is because they have several reasons why the pressure goes up. So unless you pick up these tiny little points and then understand what exactly happens in these patients, you will not be able to do a good job. That's number one. Number two is the happiness that you have when you actually tell somebody that they do not have this blinding disease, especially when somebody is been on treatment for when they don't have a problem. One group of patients to me where to tell them that they don't have a disease is a very, very interesting and humbling experience. The other thing is several of our patients, in fact several of the elderly patients who come to see me once every 3 or 4 months just to listen to that one sentence that I tell them, that you will not go blind in your lifetime. So to give that reassurance to these elderly patients, because the only fear that they have is that they don't want to be burden to their children and they want to be independent until the time they are alive. Knowing that it is a blinding disease, knowing that progressively they will lose their vision is a big fear, and that fear can kill somebody rather than them losing their vision itself. So to reassure them, to hold their hands and tell them that we are together in this journey, we will take care of you, you just don't worry about it, gives them so much of happiness that it will take them through for another few months until they come back to see you. So they are all, in fact, it's like a large, huge family that you are together with them in their journey. Several of them actually know my child as a very young boy, and they've seen them. They keep asking, how's your son? And when I tell them that he's joined medical college, they are surprised because obviously time has flown and they've been with you for so long.
Thank you, Dr. Senthil. Let's hear from Dr. Dubey.
I find glaucoma very fulfilling and rewarding. And what keeps me going every day in my clinic is the realization that I was able to make some difference in the progression of the disease and preventing loss of vision. I'll give you one example of one of my old patients who came to me with his son, and when he came to me, he was very depressed and he even lost interest in his life. He was suffering from advanced glaucoma and cataract, and his son requested me to treat him. Very hesitantly, I performed combined surgery for him, and to my surprise, he improved miraculously after surgery and could resume his reading, and he was a happy person again. And his son even commented that, "Doctor, you have improved the quality of life of our family. Now my father is smiling again, he is reading and he is behaving like a normal person." So as a glaucoma specialist, you can contribute a lot in diagnosing the disease early and treating the disease on time, and make a huge difference in the society.
Thank you, Dr. Dubey. Let's hear from Dr. Urvish Vashish.
So every day there are lot of situations while managing glaucoma that bring glow into my eyes. I will just discuss two of them. One is managing the intractable glaucomas. The patient comes to us, he is having severe pain, he is symptomatic, or he has a lot of allergy due to anti-glaucoma medications. His IOP is not getting cured, lowered in spite of surgeries, in spite of all the medications. His eyes are red and he is in severe pain. Many a time such patients say they ask for evisceration. So I ask them, just give me a chance, I will put a tube in your eye. If the IOP, if you do not become symptomatically better, I will eviscerate for free. And after putting the tube, the wow factor for me that brings glows in my eyes is that when the patient asks that now my strain is over, when am I going to get my vision back? So that is the moment that brings glows into my eyes. The second situation is whenever a patient has been told elsewhere that he or she has glaucoma and he's really worried, and he comes to me, I do all the tests and tell them, okay, you do not have glaucoma. So the moment, the change in the facial expression of the patient, all his worries disappearing in a moment, so that really brings glow into my eyes.
Thank you, Dr. Vashish. Let's hear from Dr. Tejwani.
Well, as I said earlier, it's the relationship that you develop with, or the bonding that you develop with your patients is what keeps you going, and that is what is something which is very unique for glaucoma. In other branches where you rectify a disease and the patient is happy and gone home, and after that you forget about that. But glaucoma is not like that. You have to take the patient along in your decision making, and it's a long process, and you see them do well or progress in life over a period of time is something that is very, very interesting about this branch. You develop a lot of stories actually. In fact, if I remember one of my patients who's a child, balloon seller son, who had a cylinder blast and both the eyes were damaged. So as I was treating him, I could see this child grow and complete his education. So that was the only eye he was working with, and post K-Pro he had developed secondary glaucoma. So he had multiple surgeries and n number of visits to the hospital. So as you watch them grow, it's such a lovely feeling, and that is what gives you that sparkle in your eye. even not only children. I had like one of the young gentleman, 40-year-old, who was working in Infosys, taking care of his family, and had a bad ACG, developed malignant glaucoma in one eye. So the only eye he was working with, nobody was ready to operate, and he was told at multiple places that nothing can be done. You just wait for your vision to, as long as it lasts. So when we treated him, and over the years, 10-12 years journey, later on now he brings his teenager son to me to meet. So those are the things, multiple stories that you develop, and there are endless stories like that. So that is what keeps me going.
Thank you, Dr. Tejwani. Interesting. Solving a new puzzle of glaucoma every day gives all of them a thrill. Now this is a sign of a true warrior. We'll take a break here. Let's meet up again tomorrow, same time, for the rest of this episode.
There is a general mindset that glaucoma is not a specialty, which is not true.
As we know, glaucoma is kind of a long-term chronic disease, and there are a lot of unknown things about glaucoma.
And if you love what you're doing, you can actually excel in that field. And so it doesn't allow you to rest, and that is what I love about glaucoma.
Right from the time, like I said, I chose to do glaucoma, it was not easy for me.
As I started seeing the patients, that I found my passion, that is glaucoma.